From my perspective, the key three themes for this year in healthcare are care coordination, which is really predictive analytics and workflow solutions for populations. Number two, what we call digital therapeutics, using software and potentially coaching to drive behavior change with patients. And number three, telemedicine, which is really becoming, although still nascent, very important in a subset of key face-to-face encounters that are going online. Well, I think care coordination is the real-time guidance system for patients in hospitals. So now that we have electronic medical records with real-time information deposited in them, we also have predictive analytics, the ability to say, hey, something might happen to this patient. Now that we have that in many hospitals in the US, we need to move to a situation where we use that data to intercept the patient at the point of care. As an example, if you have a patient in the hospital with a number of lab studies coming back and vital signs changing that might be at risk for a sepsis or severe infection, sometimes clinicians are delayed in picking that up clinically. But these systems, these early warning systems, can help guide therapy to identify these patients to physicians in the hospital and nurses to more effectively and more quickly treat them. Digital therapeutics is a nascent field, but incredibly exciting given all of the advancements in consumer engagement that's been happening over the last 10 years. Think of Facebook, Twitter, even your mobile phone. 10% of people admit to using their mobile phone in the shower. So these are highly addictive and engaging technologies. Health has a great opportunity in taking those methods of engagement, which actually involve neuropsychologic changes in the brain, and using them to change behavior for chronic disease patients. Some examples of this are Armada, a company that has basically digitized a diabetes prevention program and shown results that are similar to drugs at 1 year, using just software and behavioral modification. Propeller in the respiratory space is another good example. We're at the front end of this, but as we see more and more companies employ consumer tactics of engaging patients through their phones or other means, I think we're going to get to a point where a lot of care can be semi-automated and patients can help themselves improve behavior and reduce chronic disease burden. I think it largely comes down to three things. Patient technology and interest, number one. Two, payment, and three, doctor interest. And I think we're finally seeing all three. On the patient side, we have a huge commercially insured population now that are saddled with high deductible plans. So that doctor visit's no longer a $15 copay, it's a $200 copay plus an hour wait in the office. So now you've got consumers saying, hey, if I have a urinary tract infection, and I know I always get these, why can't I just use a telemedicine, urgent care visit to deal with this? Or if my doctor wants to tell me about how my lab results came back, do I really need to go into the office? These are great applications for telemedicine. But the other two legs are also important. On the physician end, we're just now getting good malpractice policies put in place to proscribe the risk of online care. Since there's no physical exam, it's a bit like laparoscopy with respect to open surgery. You're working through a keyhole. And so I think there's going to be new training for telemedical doctors that allow them to deliver this care in a safe way for a subset of traditionally face-to-face interventions. And finally, I think you have the third part of the stool, which is the payment side. As we talked about on the commercial side, we've got payment, but CMS has also stepped forward and started paying for non-face-to-face care for chronic care patients in the Medicare population. A huge shift and a very positive one for telemedicine.